Belantamab mafodotin, or Belamaf, is an antibody-drug conjugate that targets BCMA. And in the DREAM2 study, we studied two different doses of Belamaf, 2.5 or 3.4 mg per kg, in a randomized fashion in about 200 patients in total. And what we determined from that study was that in aggregate, the response rate was about 30%, and the average number of prior lines of therapy for the whole trial was 7. Which is a pretty heavily pretreated group of patients. So in this subset analysis, what we began to look at was patients that had received 7 or more or 5 or fewer lines of therapy. And what we outlined was that the response rates are very similar between those two refractory groups of patients. The PFS is very similar, and more importantly, the duration of response is also very similar between the two groups. And I think that's really important to know that in both of these late-line patient populations, more than 7 or fewer than 7, that Belamaf seems to hold its activity across both groups of patients.